Colleagues, we'll move on to the next item of business, which is topical questions. Our first question is from Alison Johnson.
Thank you. To ask the Scottish Government what its response is to the recent rise in COVID-19 cases to a level not seen since May 2020. Thank you.
Cabinet Secretary John Swinney.
So the recent rise in COVID cases, whilst not unexpected as lockdown restrictions ease, is still unwelcome. This is the experience of most countries impacted by COVID-19. The Scottish Government has had to take action in consultation with some local authorities to address this increase. Further measures may require to be taken. Test and Protect is working well and doing exactly what we need it to, identifying positive cases early and tracing contacts so they can get appropriate public health advice. Fluctuations in demand have been anticipated, and we have acted immediately to bring additional testing capacity online to manage the recent surge in testing demand across the country. This included deploying 3 mobile testing units, improving accessibility of testing, and further work to increase laboratory capacity in Scotland. Later this month, we will also launch the Protect Scotland Proximity Tracing app to complement the proven person-to-person approach of Test and Protect.
Alison Johnson.
Thank you. I thank the Cabinet Secretary for that response. The Scottish Greens have strongly supported a precautionary approach to managing the COVID-19 outbreak, and so, like many, we're increasingly concerned about the public health implications of the end of the furlough scheme. So can the Cabinet Secretary say to what extent the end of furlough is removing the option of local restrictions to deal with outbreaks?
Cabinet Secretary.
I think in response to that question, I would have to say, well, first of all, the Scottish Government would argue for and are arguing for the continuation of the furlough scheme for a longer period, because I think the experience that we are having here in Scotland is not dissimilar to that of other countries where local lockdowns or local restrictions are having to be applied, which then raise issues for the financial sustainability of individuals. So the furlough scheme type arrangements are relevant. We would always take the approach that we must take decisions based on the public health interest first. And we will argue and continue to argue for financial support to be in place for individuals who are affected by any form of restriction that is driven by the public health advice. But the reassurance I would give to Alison Johnson and to Parliament today is that the public health considerations are uppermost in the decision-making of Scottish ministers.
Alison Johnson.
Thank you. There have now been a number of incidents of transmission in schools, and a recent EIS survey shows social distancing is often absent in high schools. So is the Cabinet Secretary concerned about the contribution that this could make to the resurgence of COVID across Scotland, and what measures are being taken to ensure that we're doing absolutely all we can be to better protect pupils and teachers?
Cabinet Secretary.
Presiding Officer, I would challenge the premise of the question to an extent, that while there have been cases that have emerged amongst the school-age population and the teaching population, there is very little evidence that that has arisen because of in-school transmission of the virus. It's much more, invariably, much more the transmission within the community, although I do accept there are certain circumstances where in-school transmission has happened to a limited extent. The guidance that we've put out through the Education Recovery Group is designed to provide very clear guidance to schools about the mitigation measures that have got to be in place. Alison Johnson will be familiar with the fact that the Government strengthened those mitigations by applying the requirement that face coverings should be worn in communal areas and in corridors within secondary schools when movement was being undertaken to try to minimise the risk of transmission. But I would encourage all interested parties to follow the guidance, which of course requires there to be physical distancing amongst adults within schools and between adults and young people and students within schools. And I hope the measures we've taken, which I think are getting very, very extensive compliance in relation to the wearing of face coverings within schools, are followed in all circumstances.
David Torrance, to be followed by Mike Rumbles.
Thank you, Presiding Officer. To ask the Cabinet Secretary how the Scottish Government is expanding testing capacity, particularly as we approach the winter months, when we know there is likely to be an increase in demand due to prevalence of symptoms of common cold and flu.
Cabinet Secretary.
Presiding Officer, as I indicated in my original answer, We are taking steps to expand the capacity for testing around the country, and various steps have been taken place. To ensure that Scotland is prepared for anticipated winter pressures, our planned maximum sampling capacity by the end of October of this year will be about 41,000 tests per day. This will consist of mobile testing units, regional testing centres, the social care portal, home test kits, community testing and NHS testing. We also intend to have 11 walk-through centres, one of which at St Andrews is already operational, that will increase sampling capacity by a further 3,300 per day.
Mike Rumbles.
Can the Deputy First Minister confirm that the restrictions on liberty imposed by the First Minister in Greater Glasgow is lawful?
Cabinet Secretary.
Yes, Presiding Officer.
Question number 2, Ian Gray.
To ask the Scottish Government how it will respond to reports from school leaders that they are facing excessive and unsustainable workloads.
Cabinet Secretary John Swinney.
Presiding Officer, I do not underestimate the extraordinary efforts being made by all school staff. Their work to welcome our children and young people back into school staffs in challenging circumstances is vitally important. Our guidance on school reopening, developed in partnership with the COVID-19 Education Recovery Group, makes clear that the health and well-being of staff is a key principle of education recovery. Education Scotland, the General Teaching Council of Scotland and other national organisations, along with local authorities, currently provide a range of support to the workforce, including employee assistance programmes and online professional learning. We will also shortly launch a new and focused package of support for school staff that has been developed with the Education Recovery Group. Furthermore, we've provided £80 million to local authorities, enough to recruit around 1,400 additional teachers and 200 support staff in order to bring much-needed resilience to the education system.
Ian Gray.
Thank you. Does the Deputy First Minister understand the pressure which was put on head and deputy head teachers by the sudden shift from preparation for blended learning to preparation for a full-time return? Pressure which has continued as they now try to keep pupils and staff safe, parents informed, ensure health measures are complied with and deal with staff who are ill or self-isolating. Does he accept that head teachers cannot do all of this and also lead learning in their schools as they would wish to? And what real practical help can he offer them?
Cabinet Secretary.
I do accept, in all circumstances, the demands that are placed on school leaders as they navigate their way through the extraordinary circumstances with which we have to deal in the current context. I'm confident through my dialogue with senior leaders within education and within individual schools that whilst the demands are significant, school leaders are absolutely committed to ensuring schools are safe and that schools are strong places of learning and teaching. As I indicated in my answer, Education Scotland is providing support to schools to enhance the work that is undertaken by local authorities. We are putting in place a package of support which has been designed by the Education Recovery Group to provide further assistance. And we are trying to ensure that there are more teaching resources on the ground to assist in the delivery of learning and teaching for young people across the country.
Ian Gray.
Well, a head teacher's commitment is not in question, but they are surely hardly helped by the failure of Education Scotland and the SQA to come up with guidance for teaching of practical subjects and changes to curriculum and courses for exams. For teachers who are already trying to teach these courses and head teachers trying to manage them in doing so, when is the Cabinet Secretary going to get the SQA and Education Scotland to step up and play their part?
First Minister.
Well, I think both organisations are making their contribution to these issues. The SQA is wrestling with a number of very different views in relation to the consultation, for example, on the approach to be taken to examination in 2021. And Education Scotland is providing practical assistance to individual schools around the country and is also providing the very strong digital learning platform, which I think is essential for young people should their education be interrupted either at an individual level or at a class level or at a school level as a consequence of COVID. So I'm very confident that the national organisations are making their contribution and they will continue to contribute to the work that the Education Recovery Group takes forward, which brings together the interests and the perspective of all stakeholders within education, including the professional associations.
Claire Adamson, to be followed by Jamie Green.
Thank you, Presiding Officer. Can I ask the Cabinet Secretary how the £45 million funding for schools to recruit additional teachers and £5 million for teaching assistants and other support staff will help alleviate the pressures on senior management in our schools, and also what discussions he has had with COSLA regarding the recruitment of the additional teaching and support staff?
Deputy First Minister.
President Officer, we've obviously recognised some of the challenges that are faced by individual schools, which is why we've taken steps to expand the workforce. The information I have, the most recent information I have, is that local authorities have recruited an additional 740 teachers, and there are plans in place for the recruitment of another 250 at this particular stage, and we expect this number to increase as schools continue to assess the needs of children and young people over the coming weeks. So we remain in continuous dialogue with local authorities about the progress in utilising these resources to expand the teaching workforce.
Jamie Green, to be followed by Beatrice Wishart.
Thank you, Presiding Officer. It was worrying enough that during the lockdown many pupils were struggling to access online learning through a lack of IT and infrastructure. We now learn from the EIS survey that many teachers and head teachers and school staff are also struggling with IT infrastructure and connectivity. Surely if blended learning as a contingency is going to work, they must be given everything they need, and it's not good enough simply to say that that's a matter for local councils. What leadership is Education Scotland taking in this?
Deputy First Minister.
Well, it is a matter for local authorities, because local authorities have a statutory duty to deliver education. And I know it might not suit the political narrative of Mr Green, but that's what the law says. So schools must be supported by their local authorities, who must deliver the leadership and the practical support to ensure that their staff, who are their employees, have got all of the equipment that they require. So it is a matter for local authorities to take that forward. The government supports it and we enhance it. We've delivered additional devices to local authorities, where the government has added new resources to make it easier for these commitments to be deployed. So it's important that every member of staff and every pupil has got access to the digital technology to enable them to fully take forward their participation in learning and teaching.
And Beatrice Wishart.
Thank you, Presiding Officer. These reports on excessive and unsustainable workload should serve as a reminder that there are real people at the other end of these decisions. On top of working throughout the pandemic, schools and their staff have had to work around U-turns from the Scottish Government. The Education Secretary waited until the last days of term to score out the first unworkable plan after teachers had spent weeks wrestling with it, making working through the summer inevitable. Does the Cabinet Secretary know how much overtime was accrued over this summer?
Deputy First Minister.
I really don't think it helps the debate about these issues to have the kind of terminology that Beatrice Wishart chooses to use in respect of this matter. I don't think that it's a matter of regret that there was a significant reduction in the prevalence of COVID in May and June, which resulted in us being able to contemplate the reopening of schools full-time. I would have thought that would be something to welcome, as opposed to something to complain about. And I think members of Parliament need to think carefully about the implications of some of the things that they say in this respect. We have a perfectly robust approach to blended learning, which we may need to use if education becomes interrupted because of COVID. I don't want that to be the case, but if the prevalence of... I've just answered a question from Alison Johnson about increased prevalence of COVID. I don't want COVID to have increased prevalence, but if it has increased prevalence, it increases the risk of affecting our ability to deliver full-time education. Now, we can deliver full-time education, the first part of the United Kingdom to be able to return our schools full-time, as a consequence of the commitments made by members of the public to reduce the prevalence of COVID. I think we should welcome that, not complain about it.
Question number 3, Rona Mackay.
Scottish Government what discussions it's had with the UK Government regarding the Scottish Affairs Committee report on safe drug consumption facilities.
Minister Joe Fitzpatrick.
The Scottish Affairs Committee inquiry into problem drug use in Scotland took place in 2019, and I gave evidence on the 9th of July 2019. The UK Government's response was published yesterday, and I am already on record setting out my disappointment in the rejection of the majority of the recommendations of the committee. Of 19 recommendations, the UK Government rejected, I think, 16.
Rona Mackay.
Thank you for the answer. I'm sure the Minister, as you said it, was as disappointed as I was to hear that the UK Government does not accept that problem drug use is singularly a health issue and has rejected the recommendations put to them by the Scottish Affairs Committee report. Given that we here in Scotland recognise the severity of the public health emergency, will the Scottish Government continue to press the UK Government to either change the law or devolve the powers so we can take the necessary action to reduce the harms and deaths associated with drug use?
Minister Joe Fitzpatrick.
Yes, the UK Government's determination to continue to look at this problem as through a justice-based focus rather than looking at it through a public health focus is hugely depressing. And I fully intend to continue to press the UK Government for action on a variety of matters where we want and need to see action to tackle the public health emergency that we are facing in terms of drug deaths. For example, I want to see action taken to regulate pill press machines and to amend existing legislation to widen the ways in which naloxone can be distributed. We are clear that we want to tackle this matter through an evidence-based, health-focused approach, but our ability to implement several aspects of this is, however, being frustrated by areas of reserved legislation and the refusal of the UK Government to take action that will help us to save lives.
Rona Mackay.
Thank the Minister for the answer. Can I also ask if the Minister if the Drug Deaths Task Force has continued its work during COVID-19 pandemic, and what further steps will they be taking in the future?
Minister.
Yes, the task force has continued to meet virtually throughout the pandemic, and it's worked really closely to take forward a range of actions that have helped to mitigate the increased risks for those who may be at risk as a result of their drug use as a result of the pandemic. And there's a number of areas where I think action has been taken, which I think, and learning has been taken, where I think we can use that after the pandemic to improve the support that we give to people across Scotland.
Annie Wells, be followed by Neil Findlay.
Presiding Officer, there were approximately 352 rehab beds in Scotland in 2007. In the 10 years following, that number dropped to less than 70. That's 282 rehab beds that have been cut under this government. Surely the first priority should be to increase the number of people accessing treatment and revising the cuts to the drug and alcohol partnerships made by this government.
Minister Joe Fitzpatrick.
I think it's really important that we don't get ourselves under the illusion that there is any one silver bullet. I think all the support that we can provide to people is important. That's why I think I've said previously in this chamber and to members when we've been discussing drugs between spokespeople, that we are looking at whether the pathways into rehabilitation are appropriate and are properly accessible. One of the things that we did look at during the pandemic was rehabilitation in terms of a national route from prison through into rehabilitation, and that looks like that's been successful, and it's a model that we might look to expand on how we take that forward to improve the range of options and the pathways. We've established our working group to consider the provisions of residential rehabilitation services and make recommendations to strengthening referral pathways. That work is being chaired by David McCartney, who's the clinical lead of Lothian and Edinburgh Abstinence Programme, and I look forward to be able to bring more news around that to the Chamber in due course.
Thank you. Neil Findlay, to be followed by Willie Rennie.
Presiding Officer, the Tory approach to Scotland's drugs crisis is ridiculous and it's a disgrace, but there is a huge amount that we can do in Scotland on mental and physical health of drug users, on residential rehab, on policy coordination, care and policing, and much, much more. So will the Minister please stop looking at this desperate situation through a constitutional lens and instead take the decisions that he has the power over and help save lives now. Not in another year's time, not in 5 years' time, now.
Minister Joe Fitzpatrick.
So I've tried very, very hard not to look at this issue through a constitutional lens, but we have to come to the realisation and acceptance that there is an uncomfortable interface between the public health approach, the justice approach, both of which are devolved, and drugs legislation, which is reserved. And there is no question that that interface is making it difficult for us here in Scotland to take all of the actions that we can take. There's no one is suggesting that the actions that we can work with the UK government on in relation to things like pill presses and things like the safe consumption places, no one's suggesting they are a silver bullet, and there's a lot of other work going on. One of the things that I found challenging in relation to the pandemic is, prior to the pandemic, I was spending a great deal of time going around and speaking directly to service users and service providers all across Scotland, and that's something that obviously is really difficult to do just now under the restrictions around because of the pandemic. But it's really important that we listen directly to the voices of people who are using those services and providing those services, and that's what I'm continuing to try to do as best I can. The task force is working hard alongside us to do that. There is a huge amount of work to do, and we are taking it forward at a pace.
And Willie Rennie.
The Minister is right when he says there is no silver bullet on this, and I commend him for his work in pursuing the consumption room policy. But will he be as equally strong advocate for the Portuguese-style commissions which have helped deal with the drug problem in Portugal?
Minister Joe Fitzpatrick.
I think there's no question that the public health approach that was taken in Portugal some 20 years ago has led to that country now going from being one of the highest level of drug deaths now to one of the lowest in Europe, and it's been a remarkable transformation. Now, clearly, you cannot take a legal or a health system from one country and directly implant it on another, but there are huge lessons for Scotland from Portugal, from Canada, from lots of places in Europe. Safe consumption facilities are just one example of where a public health approach is saving lives right across the world, and I really, really hope that when I meet with the UK Minister on 2 occasions later this month, that he will have found a way to square that circle and move away from a justice-based approach into a public health approach, which the evidence internationally is will save lives.
Thank you very much, and apologies to colleagues. We do not have time to take all the questions today. Point of order, Mike Rumbles.
Deputy First Minister just confirmed to me earlier in the session that the restrictions of liberty imposed on over 1 million people is lawful. When I raised this as a point of order last week with you, you pointed out that no regulations changing the law had been made, and that these imposed restrictions were simply guidance or advice. Now, as I recall, you said that if the law, to the First Minister, if the law was to be changed, regulations needed to be laid. Now, I am concerned that our proper parliamentary procedures are being followed, and that's what I'm trying to find out. So, Presiding Officer, I would ask you again today, have regulations to change the law restricting people's liberty in Glasgow now been laid before Parliament, or is this a continuation, as it was last week, of just guidance or advice? Now, the reason I ask is that I, for one, as an MSP, have been approached by people affected by this, and I have been saying, as a result of the intervention last week, that this is advice and guidance, which is good advice and guidance. It's not the law. Now, I think there's confusion, and I really want to know, have the regulations to change the law been laid? Because according to the Deputy First Minister, the actions of the First Minister are indeed lawful.
Thank you very much for the, for the point of order, Mr Rumbles. I can't do much more than repeat the advice I gave last week, which is that the term restrictions is used to cover both voluntary guidance and matters for regulation. all regulations are laid before. If it is a matter of changing the law, these regulations are laid before Parliament, and Parliament does have a chance to express its view on them. I'm afraid I'm not in a position, it's a matter for the Scottish Government to clarify whether or not in this particular case this is guidance, statutory guidance or regulation. And that would be a matter for, it's not a point of order for the Chair, it would be a matter for the member to put to the Minister or to Ministers either in a written question, an oral question or other opportunities in Parliament. I hope that addresses the point of order. Apparently not. Mr Rumbles?
Forgive me. Could I just follow up on that point of order? I'm genuinely trying to seek the reality here. I think it would be immensely helpful if we knew, I mean, the regulations need to be laid to the parliamentary authorities. The parliamentary authorities must know whether those regulations have indeed been laid. If they haven't been laid, there's no change to the law. It's a simple matter. What I'm trying to find out, and I haven't found out since last week, and this is really important because over 1 million people are affected. I need to know, and I think MSPs need to know to fulfil our duties, whether this is a change in the law or is it simply advice. Because if it is the change in the law, the police will enforce it. If it's not a change in the law, the police will not.
There's nothing wrong with Mr Rumble's line of questioning and the information he wishes to elucidate. As a point of order, what I'm suggesting is that this is not a matter for me as Chair. It doesn't affect the orders of this Parliament or the standing orders. What I'm trying to clarify is that the member is quite at liberty to put a question to the Minister on various occasions. In fact, he had an opportunity earlier. I'm sure there'll be other opportunities this week. He can do so in writing. He may be able to approach the parliamentary staff in Spice, who would certainly be able to clarify whether or not any regulations have been laid. But it might be that the regulations are delayed. Sometimes orders are made and the member will know that the regulations come in after the effect. They have to be still approved or passed by Parliament, but there might be a delay. Now, that is a matter for the Government to clarify, not for the Parliament. But the Parliament can certainly assist in providing that information. I hope that's helpful.